Good evening, everybody. Welcome to this Instagram Live. We're really lucky to have Christopher Clarke on board with us today, who's a consultant radiologist. I'm just waiting for Christopher to come on board. Hope you guys are well. Hope you've had a good day. We're going to be talking about radiology applications and what to think about if you're thinking of a career in radiology. Thank you so much, guys, for you who are tuning in. I can see Radiology Cafe has joined, so I'm just going to see if I can Hope you guys are doing good. Thank you for tuning in. Hope you've had a good day. I know it's fairly late if you're UK based. I know we have some people from board. Hi, Chris, how are you doing?
Hi, good, thank you. How are you?
Good. Thank you so much for coming on board. I'm just going to get my angles right. I just did a quick intro for people who are joining us. It's good to see people coming on board. You got a 51 already on board. So welcome. Thank you so much for your time, Chris.
You're very welcome, yeah.
So a really quick intro, if you didn't catch it, this is Chris Clarke, who some of you guys will know from Radiology Cafe, an amazing website, which we'll be talking about a little bit later on, which covers everything to do with radiology. It'll be good to hear Chris's story and some thoughts on radiology applications. So once again, Chris, a quick intro for yourself, if you could.
Yep, so I'm Chris Clarke. I run a website, Radiology Cafe, and I'm a consultant radiologist in Nottingham in the UK. And I've been helping trainees with their kind of application, applying to radiology since 2011, so nearly 10 years now.
Wow.
Yeah.
Wow. And we'll talk about that journey about helping trainees, because you've helped thousands and thousands of trainees by the looks of things, in terms of getting into radiology and then following that pathway through to becoming a consultant. So it'd be great to hear some of your thoughts as we go through. Lots to cover today. We're going to try and keep it short and sharp. I hope it's going to be as valuable as possible to people who are watching. Please do ask questions if you're interested in radiology. You have any questions, we will try and answer them. The application process, what it's like to be a radiologist, and anything in between. So Chris, we're going to start off with 3 reasons to be a radiologist. What are the 3 biggest pros that you can tell these guys about radiology?
So I think one, it's fun because you have, you're the kind of doctor's doctor. So you're looking at the X-rays. What I enjoy most about the job is when you have clinicians come up to you, particularly surgeons. So I'm an abdominal radiologist by specialty. Okay. I do intervention. So a lot of my stuff is sorting out post-operative complications and bowel issues. And there's nothing better than having, the surgeons come up and say, what's going on with this patient? And you look at the scan and together you kind of come up with the answer. And I find that really rewarding. I love that. It's the best bit of the job.
That's great.
You're not just sitting in a room reporting. So that's number 1. 2, flexibility. I report from home now 2-3 days a week. And I can be flexible. So when I go in the hospital and when I report from home, because I've got a home reporting station. So I do go in a lot because I do a lot of intervention, but some of my colleagues have a whole 2 weeks where they just don't go in at all and they can work from home. So it can be quite flexible like that. It's very good so I'm thinking particularly for, if you're a parent and you've got kids and you want to have a day off a week and certain days, it's a specialty that works quite well for that kind of lifestyle. 3rd reason. Don't know. There are 2 reasons really. I don't know.
Okay. Well, if you think of a 3rd one, just shout it out, because there's got to be more than 2 good reasons to be a radiologist, I'm sure. No, that's great. And obviously radiologists are going to sell radiology very well. And we have a lot of trainees who are caught between decisions between, say, general practice, radiology, psychiatry, and lots of other things. Lots of career decisions have to be made. So what would you say are 3 things that you would change about being a radiologist? The things that maybe someone needs to think about if they're 50-50 about a career of this? So
in terms of so you're asking me whether what you would change to get someone into radiology, or
no? I guess let's have some maybe possible drawbacks of a career in radiology then, just so we get a balance view.
Okay, well, it's hard. As a radiologist, I'm a bit biased.
Yeah.
Okay, so the first drawback, I guess, is you're not on the ward all the time, and you don't have as many patients under your care. So that's probably the biggest thing. As a GP or as a consultant in another specialty, you probably have, your patients. You can say, right, I'm in charge. They're going to come to me or my registrars or my team, and we're going to sort them out and ask for help from various specialties. Now, in radiology, that doesn't really happen. Normally, you're the one kind of at the periphery helping others, and that can be. It depends what you get. What do you get as your reward from medicine? If your reward is having the patient say, "Thank you, doctor, that was great," we do get that when we do intervention, but you'll get that a lot more working as a GP or as a different specialty. So that's probably one drawback. The second drawback, and you have to like images and computers. If you don't like looking at images and computers, and you're not very good at thinking in 3D and visualizing things, it's maybe not the career for you, because you need to have that kind of brain where you can kind of look at an image and you can kind of think about how it works. We do have some colleagues that maybe don't think like that, and it's harder work. I think you can still be a radiologist, but it's a lot more work.
Yeah.
Another reason. I guess, you know, you get a lot of referrals in, and you kind of have to deal with a lot of different people, and I quite like that, but some people don't. You know, actually, maybe you want to work in a more close-knit group. You know, as a GP, I guess for example, you might work with your practice. You'd have a very good relationship there, and maybe a few other places, but I imagine that's mainly your bubble. Whereas actually, radiologists, you have to deal with so many different specialties within the hospital, and you can have all sorts of characters, and there's a lot of things you can't necessarily control because of how big the hospital is. So that's probably one thing to think about.
And that's really good, actually, because it's important for trainees to think about both sides, and the physics thing is really interesting, because you know, how much, I didn't really think about that. How much do you need to be into the whole physics and science side of things? As you said, it's useful, but not 100% necessary.
That's right. Yeah, it's something you have to do in your first year and learn the physics, and it goes in like a wave. So at the first year, you get really good at physics and you learn it, and then you kind of get a lot more clinical. But then you really need to learn the physics again when you get more senior, because you're starting to think about MRI sequences and which ones to use, and having basic understanding is really helpful. So you kind of have to almost relearn it. And I think if you enjoy physics, it's a lot more fun, I think, and you can get a lot more out of what you do, but you don't need to know it. You can pass the exam and then forget physics and still be an okay because it's pictures and it's patient.
Yeah. So, and that's really interesting, actually. And so you deal with radiology trainees day in, day out, I guess. Nottingham Hospital are busy places. So what's the normal radiology trainee journey like then? So say someone's already applied, and we'll come on to the application in a second, but say someone starts ST1 in radiology, what's the normal run-through pattern for a trainee?
So typically training is 5 years. If you want to do interventional radiology, then it's an extra year at the end, so 6 years. So when you apply, you obviously ST1, you have to learn a lot in that first year. So you have to learn basic X-ray skills, ultrasound skills. You have one exam in March or February, March of that year, which is on anatomy and physics, which is kind of FRCR Part 1 exam. So you do that, and then usually the second year is kind of when you go on call, and you start to be a bit more, not independent, but you know, you're making decisions, you know, out of hours, and you spend your second year really getting up skills and learning CT, learning the different modalities, getting better at reporting. The beginning of your third year, you then have another exam, the Part 2A, which is a 6-hour long sort of monster exam covering everything. Covers pediatrics, MSK, neuro, cardio, everything, every part of the body. And that's a difficult exam, really difficult. It's 2-3 hour papers in one day. It's crazy. And then you pass that, and then the fourth year, you then do your Part 2B, which is kind of a Viva exam where you get shown films, and you do what's called rapid reporting, where you get shown 30 films in 30 minutes, and you kind of have to say if they're normal or abnormal.
Wow.
And it's actually, it's the end of your third year, so beginning of your fourth year that you subspecialize. So your first 3 years is kind of core training, learning general skills. And then the last 2 years of training, you kind of choose 1 or 2 areas to specialize in. So some people specialize in just one area, and we call that kind of you go to level 2 in that area. So that might just be neuroradiology, or in my case, gastrointestinal abdominal radiology. But you can maybe do musculoskeletal and neuro, but both to level 1 in those 2 years. And that's kind of whether you go to a district general hospital or a big teaching hospital, you still have to kind of have an area of interest.
Okay.
Yeah, and at the end of it, you get your CCT.
So it's so generally a 5-year training program. And are you based is there any kind of reapplication processes in that, or is it if you get in, you're pretty much going to get to the end as long as you follow the hoops?
You get in, it's run through, so it's 5 years. Right. Some places for the subspecialty training, if you have too many trainees applying for the same thing, you might have like a little mini local interview thing to decide who does what, but that doesn't affect training. That's just to decide what specialty you do, what your trust can offer. You tend to have like a base hospital, but you do go on rotations. So Nottingham, for example, you're usually in Nottingham for the first 1 or 1.5 years, and then you might do 6 months at Derby or another hospital, and then come back in again. You rotate.
Okay, so one base hospital, but you're in your peripherals around throughout your 5 years. And what would you say is the completion rate for people who start as an ST1 who get to the end in CCT? Is it fairly high? Is there a dropout rate? What have you seen?
I only know from local, but it's fairly high. Like most, I don't know. I only know of maybe 1 or 2 that have dropped out.
Okay.
It's very low, and that's in their first year, and that it's because radiology is just not for them. Yeah. And we kind of want to avoid that. You know, we try and make the interview process such that, you know, we ask you, are you really interested? Have you done your taster week? Do you really understand what it's like to work as a radiologist? Because we don't want people applying and taking places away from others and then dropping out, because that's but we're a very varied group. You know, we have people that have come from F2. We have GPs that have changed over. We have very senior surgeons that have come in, orthopedics, anesthetics. So you have a very mixed range of skills within radiology, which is really useful.
Yeah. I've certainly seen a lot of, well, I know of a couple of GPs at least who, one in the middle of GP training switched to radiology, and one who became a GP and then switched to radiology. So
it goes the other way as well. So,
no, absolutely. And so that's really useful. So 5 years, because a lot of people think about training and lengths of training. GP currently is 3 years. A lot of specialties can be 8 years. So this is kind of in the middle, which is not too bad. And you've mentioned a couple of opportunities within radiology already. So where do you think, what are the main branches of where someone could go as a radiologist then? So you're in radiology training. What are the kind of opportunities that people have within that field itself?
So it's still one of the generalist kind of specialties. In that way, it's quite similar to similar to GP, but you can do a lot. So you can become a pediatric radiologist. You can do specialize in abdomen. You can specialize in, and your career can change. Like, I'm an abdominal radiologist now. I might decide I like chest and start doing chest and get better at chest, and then I'll be a chest radiologist in 3 years.
Yeah.
You can go whichever way. You know, we generally have musculoskeletal, neuro, chest. What else? Gynae. You know, uro radiology. You have head and neck radiologists that specialize in sort of neck stuff. In interventional radiology, they're not just one group. You know, we have vascular radiologists, which mainly do vascular and EVAR and those sort of surgeries. And then you have the neuro interventional radiologists, who mainly do the embolization, coiling, aneurysm, that sort of stuff. They have people like me. So I did 5 years of training, but I do a lot of intervention as well. So you don't have to do the 6 years to do intervention. So I do nephrostomies, drains, rigs, portacath insertions, lines. You know, I'm sort of learning PTC at the moment, which is, you know, putting wires and stents straight into the liver.
Yeah, wow.
You can do all these things without being an interventional radiologist, depending on where you're training.
Yeah, wow. It's a huge variation then, and a lot of that happens within your training years. It's not like you finish and then you have to choose where you go and do extra training. It's kind of, you choose it as you go along. Yeah,
so you choose because and everyone's different. So some of my colleagues have done very similar training to me, and they didn't enjoy the intervention. So actually, everyone does biopsies and drains and basic things, but maybe they don't. You know, other people might enjoy it more and go even further. And actually, as long as you're trained to do it and you're safe, it doesn't really matter. And people tend to do things in their area. So the neuroradiologists will tend to do the lumbar punctures and, you know, things like that. I don't do them. I did them as a trainee. I did a lot of joint injections, but I haven't done them for years. I wouldn't do them now.
Yeah.
Musculoskeletal radiologists do that. But as a GI radiologist, it's much more useful if I can do NJ tubes, NG tubes, gastrostomies, those sort of things, you know, esophageal stents, because you're in MDT and you're discussing with the surgeons things, you kind of know the complications and which patients can have it or not, and make decisions then. I think if you don't have that sort of rounded thing, then it's hard for you at an MDT to make to say, oh yes, they can have this drain, because you might kind of say that, and then actually someone who does the drains properly will say, actually no, it's not possible. So it's about you getting the right skills for what you're doing.
Wow, okay, that's really helpful. So anyone who's watching this thinking about what does a career in radiology entail, that's given a really good snapshot actually, pros, cons, opportunities, options. So let's talk about application then, because a lot of changes going on at the moment with COVID, and radiology from what I've seen and what you hear is a very competitive field to get into. Is that fair to say?
I think it is. I was looking at the competition ratios, and yeah, the applicants to posts, it's about 3.6 to 1, but that doesn't mean too much because people do apply to more than one job. So I never look at don't look at the application competition ratios and think, oh, this is really bad, but it's generally around 2 to 1. Certainly interviews to posts is roughly 1.8 to 1. That was last year. But we had just over 1,000 applications, and there are just over 300 posts.
Wow, so UK wide 300 posts.
And I think that's just England, Scotland and Wales. Yeah.
Okay.
A separate application process, and I'm not that clued up on the Northern Ireland application process.
Okay.
I look, they have very few training posts, like 6 or 7. I think it's quite so. It's very competitive in Northern Ireland.
Okay. Yeah. Well, it's competitive generally. So 1,000 applicants, about 300 places.
Yeah.
And tell me about the current application process, Chris, because obviously a lot of specialties, it's changed completely how you get into these specialties. What's the impact been on radiology? How is it now? And how did it used to be, very briefly?
So it used to be that, because it's all changed with COVID. So I'll tell you what it used to be. So you used to apply between November and sort of beginning of December online, and it was minimal. It was basically, there's no white space text areas. It was, you put in your referees, your details, your degrees, and send it off, sort of thing.
Yeah.
You then get sort of long listed. So they basically filter out anyone that doesn't have GMC registration, the kind of basic things you need to have, FY2 equivalent competencies.
Yeah.
Once they've done that, everyone takes the MSRA test, which I think you're going to cover. You know much more about that than I do. And then based on that, usually the top 600 in that will then get invited to interview. Okay. And then of the people that are interviewed, then it's about 1 in 2 chance. The top 300 or so will get the jobs. And the interviews are done in person and usually have a couple of stations.
Right. Okay. So that's what has been happening for many years, I guess.
Yeah.
And then this year, how's it all changed? Because that's what people are asking us a lot.
Yeah. So this year is very different, and I'm only going by what's on the website, what current trainees have told me, and what's on the Oriel website and Royal College. So this year, I've got it open in front of me. So the applications opened on the 5th of November, and they close on the 1st of December at 4 o'clock. As part of the application, which is different, you do need to do a portfolio self-assessment. Now, previously, this was done at the interview stage, but now what we're saying is, okay, have you got, and I'll give you some examples. And my webpage is timed out, but essentially it asks you things like, do you have for teaching, you give yourself 2 points, 1 point, or 0 points. If you've got a postgraduate certificate in medical education, you'll get maybe 2 points, or something else like that. Run a national course, local course, 1 point, not done much, 0. Same for research. If you've got a PhD, 2 points, and you basically self-score. What will happen then is they will ask you to upload your evidence remotely at the end of December. And so you upload that online, and they'll check that along with your score. So don't lie, because, if you do, they will it's an easy way of filtering people out.
Yeah.
Make sure it's accurate. That's part of the interview process. I think the evidence upload is between 23rd December and 7th of January.
Okay.
So don't put anything you don't have evidence for.
So this is everybody. This is no one's been taken out of the process yet. This is everybody who's applied, who's eligible.
They may have done a long listing before this. So if you don't have GMC, if there's basic things in your application, like you're not a doctor, they probably have taken you out in early December. Okay. They do these things first. Yeah, but most people will get through that. You have to be basically not appropriate for the job. Yes. What you do then is, as you say, you upload the evidence, then you do this multi-specialty recruitment assessment, and that's between 28th of January and 12th of February. And that's at the Pearson View centres. So I think you go out to centres locally, you book it online. Do you know about, you probably know more about this.
Yeah.
You then do the test, you get the results sort of end of February, beginning of March. I think at this point you're asked to rank your deanery preferences. And it might be before that, because the top 50 people in the MSRA score will automatically get a radiology place. And that's new this year. Previously, it always used to be a combination of the MSRA and the interview score. But yeah, if you do really well, you'll automatically get a post. So it's really important to do well in that exam. Wow. Of those that are not in the top 50, but maybe in the top 600, you'll then get invited to interview. And they're all online, right, using Teams. And it's just one 15-minute interview. And the main questions they're going to be asking is about your commitment to specialty. So it'll be, why do you want to do radiology? Not usually why, but, show me evidence about, why you've done, why you want to do this. And the interviews are early March, and the initial offers are by 12th of April.
Okay. So very different to what's previously. Yeah, very different. So it's almost sounds like it's flipped top heavy, really. So where the portfolio bit would come in the interview bit normally, it looks like they've asked for a lot of that evidence early on.
Yes, and actually that will be weighted as part of your final marks. So that the weighting is very heavy on the MSRA and your portfolio evidence, and then the interview is going to help decide, because a lot of people are going to have very similar portfolio evidence and very similar MSRA scores, and it's going to be the interview that's going to weight them.
Right. So your portfolio score and your MSRA score get combined, and the top 50 from those get a radiology post, or is it just the MSRA top 50 irrespective?
That's a very good question. Let me have a look. Let me see. I think I made a note of that. Apologies, because it's also
That's
new.
All right. So and it's the same in most specialties. People are wondering what actually happens this time.
Top 55 scoring applicants. So I lie, it's not the top 50, top 55. It doesn't matter. Just do your best.
Yeah.
But if you don't get in that top 55 and get to interview, then the MSRA is weighted to contribute to your final selection centre score, along with your interview and validated self-assessment score. So it doesn't say. So I assume that no matter what your portfolio score is, if you're in the top 55, you'll get a post. That's what I take from this.
Yeah.
But I don't think they'll ever truly clarify that. And because this is new, I'm sure the assessors are also kind of just feeling their way as well.
Yes.
For college, so I can't imagine they've got all these rules planned out and things, because this is the first time we've done it. So I think we're going to try it and then see what happens and work around that. Okay,
but whatever it is, MSRA is a super, super important thing to get right, isn't it? And you almost have to, well, it's a good route in, isn't it? Get this one exam right and you're in, basically. And a lot of people are paying a lot of attention to MSRA at the moment because it's so important to so many specialties. GP, for example, is all about MSRA. There's no interview. Psychiatry, there's no interview this time around. So, and radiology, it sounds like it's a big thing as well. So for anyone watching who doesn't know about MSRA, it's essentially a two-paper assessment. One paper is going to be assessing your clinical side of things, and one paper is going to be assessing your SJT, or situational judgment side of things, so professional dilemmas. And I think in terms of preparing for MSRA, a lot of people just do lots and lots of questions, which is a great thing to do, but understanding background guidelines, looking at the MSRA blueprint, knowing what kind of clinical topics are coming up, making sure you understand good medical practice, for example, to understand how to answer SJTs. These are really, really important. We'll talk about some of the resources that we have at the end, but MSRA, very, very important by the sounds of it for radiology going forward. And this is all for August 21 start. So do you have 2 rounds for radiology, or 3 rounds normally in a year for radiology entry?
Normally we just have the one. We
one.
Usually completely fill in the first.
Okay, fine. So I guess you never have gaps in your spaces.
We've had 100% fill for every year except for this last year, and that must have been because some people have dropped out. I don't know why.
Okay.
Pretty odd. It's been 100% for many years now.
Okay. And if anybody's watching this, then we do have a coupon that gives you 10% any of our MSRA products, which we'll talk about at the end. But this moves on to Radiology Cafe then, because this obviously sounds like it's a huge part of Your Life, Chris, Radiology Cafe, and we were looking at the website, and it's just got mountains and mountains of information on there that help, like we said at the beginning, people preparing to get into radiology, but also then getting people to the end of radiology training. So how did all that come about? When did it start? And how has it progressed over the years?
So it started as a hobby. Well, it started with me and a friend. We wanted to do an interview course. So when I was end of F2, I think we just applied to radiology. We got it and we thought, well, we need to share our knowledge. This was back in 2011.
Okay.
And so the interview course never really took off. What I did do is get the website up and running. And it was a very basic website with just some information on the interview process and career in radiology. And it's been a hobby. So I've just kind of added to it over the years, developed it, redeveloped it, done it all myself as kind of a hobby, the programming side. And now it's got all the information on sort of the interview process for radiology, lots of information on the exams. It's got some mock examinations for the first anatomy exam for the ST1s, and lots of physics notes again for the ST1 trainees. A little bit for medical students. It's had this resource, Radiology Basics, which was developed by a colleague in Leicester, who he wrote this cross-sectional imaging book, Vikas Shah. He's called the X-Ray Doctor. Worth following him. He's a good guy. And
on Instagram, I've definitely heard of him.
He's got a very big following on I think Instagram and Twitter. And he wrote this book with Melissa Sear, a radiology trainee at the time in Norwich. So they had that as a book, and I said, I could put it on here as well if you want. They said, okay. And so it's just grown from there. And the latest thing we've been working on is, I say, we put 20 mock exams. I'm working on some mock rapid reporting exams for the 2B. They're going to hopefully be finished Christmas time, but it might need a bit more programming till they're up.
Yeah.
And most of it's free. As I say, I try and keep the website just open so everyone can just access it and get that information.
It's certainly a great resource, and we've been flicking through over the last couple of weeks because we're lucky to have some of our courses linked through your website. But it's just amazing how much you've put into that site and how much value there is from people. So if you haven't looked at it, the website name, is it, just want to give it to people in case they're watching?
It's one word, radiologycafe.com.
Yeah, fantastic resource. And if you're thinking about radiology, or if you're a radiology trainee who doesn't know about it, which I'm sure you won't be one of those, have a look at it. There's so many things on there. But not only just on the website, you do a lot of social stuff as well. Obviously, Instagram is big for you. You do a lot of stuff on Facebook as well, don't you?
Yeah, I post. I used to have I've written a book on chest X-rays for medical students and abdomen X-rays, and I used to post a lot of things on there on Facebook. This was back before they kind of shut down all the pages being seen. I think I've got about 50,000 nearly followers on one of the groups, but I don't use it so much now because unless you pay for the ads, you can't get.
Yeah.
Instagram's been really good. I've been posting lots of sort of mock anatomy radiology questions on Instagram, and I basically go a bit of Instagram, a little bit of Twitter, and a bit of Facebook.
Yeah, it's really good. It's the easiest way to connect, isn't it? We do a lot of our teaching for GP trainees and those for MSRA on social media. That's a huge way to educate people now, for people to learn passively, and it's great.
First Instagram Live.
Yes,
So this is an education for me.
Yeah, it is great, and you can just see how many people are getting benefit from it and value from it, and it's just a great way to connect. So I think what you're doing is amazing, and it looks like you're going to go from strength to strength, especially with the social media base that you have. So we're really lucky to get our stuff on your site, and we're lucky to have a 10% discount coupon for anybody who uses Radiology Cafe. The code, if anyone watching, is Arora RADCAF10, ARORA Cafe CAFE 1010. So if anybody uses that code, and I guess now it's out to the public, so even if you haven't come through Radiology Cafe, go and look at the website because it is super, but use the code, you might as well get 10% off. That's any MSRA resource. And we have MSRA online courses, MSRA audiobook courses to save you time, increase efficiency while you're traveling, for example, MSRA mock exams, and MSRA flashcards as well. So please do check those out on the website, auroramedical.education.co.uk. Chris, I just want to find out a little bit finally to end with about your working week. What's your working week? How do you fit it all in? The clinical side of it, the hospital side of it, the website side of it, and everything else that you do?
It varies a lot. I'll give you a typical week. So Monday morning, I do the rota for our body group of consultants. So there's about 16 of us that do non-head and neck, non-MSK, non-neuro. And so I plan the rota sort of a month in advance. So I spend Monday morning for an hour sort of figuring out the next month and doing that. Then I do a bit of reporting and teaching for the trainees. And then every few weeks I have the inflammatory bowel MDT on Monday lunchtime. In the afternoon, I do an interventional radiology list at the hospital. So that has whatever's on. It could be a stent, it could be a drain, who knows. I just turn up and then we'll see what we can do.
Yeah.
And then, Tuesday I do a fluoroscopy list in the morning. And again, it's a teaching list for more junior trainees. And because there's always a consultant on it, we tend to put the complex cases on there. So just the barium swallow tests, we tend to put in the tubograms and sinograms, where we stick wires through little fistulas, put some dye in, take some x-rays and see where they all connect, that sort of stuff. And in the afternoon, I either have it off or reporting. And if it's off, I tend to spend the afternoon doing some website stuff or doing some other, have a lot of things going on in management and with BISGAR, which is the British Society of Gastrointestinal and Abdominal Radiology. So I'm training BISGAR, and we've been organising the meeting next year, and with all the online changes with COVID, that's been a lot of work. Wednesdays, I do small bowel ultrasound in the morning. And that's kind of paralleled with the inflammatory bowel disease clinic. So we have a very close relationship with our gastroenterologists. And we're starting a sort of same day service. So they will see the patient and send them straight down to the ultrasound, and we'll do the scan and try and get them back to clinic. So we're trying at the moment. And again, the afternoon I have off. And then Thursday, I'm kind of the consultant of the day for our big, in terms of reporting the scans. Right. So all the A&E and the inpatient CT scans. And I have 2 registrars usually that work with me, and they will do the first report and then I'll check it. Okay. And I also do any inpatient interventions. So any drains or cholecystostomies that might need doing, I'll do them in the afternoon. Friday morning for us is MDT. So we have either the colorectal or the hepatobiliary MDT. So we'll be reviewing all the cancer cases. So I usually spend a bit of Thursday looking at all the cases beforehand, making notes, so that when I'm at the meeting, I can kind of present the findings and we can discuss about, do they need chemo or surgery? What's the best thing to do? And that, as a trainee, MDTs are quite, they're quite heavy. You need to know a lot for an MDT, and I found them quite difficult to start off with. But as a consultant, they are probably the best thing, because actually, once you do have a better understanding of how it all works, it's great because you've got all your consultant colleagues there from all the different specialties, all bringing their own expertise. Yeah. Just learn new things every week. It's brilliant. And in the afternoon, again, is a session where I can either report, and I'll be reporting CT colons or MRI scans. And again, usually with the trainee, checking their work.
There, beside, yeah.
So yeah, it's different. Wow. So I work in a teaching hospital, so I do have a lot of trainee teaching time. Yeah. I coordinate the foundation teaching program, which is not foundation in terms of foundation trainees, but we call it that for our ST1s, because it's kind of the foundation in radiology. Yeah. So I do the anatomy and physics teaching for them.
That's amazing.
And if you're a district general, you might be doing more reports just straight off without. So there are differences where you choose to go after a consultant. But as a radiology trainee, you'll usually always be in some sort of big centre with lots of other trainees. So you get a similar experience.
But I mean, just listen to that week. I mean, you could just see the variety. I mean, there's no 2 days are the same, and it's not just variety within clinical stuff. It's variety in lots of different things, and it's amazing how, as a GP or someone who's not in that radiology field, it's amazing to think, well, radiology is, you have your perceptions, but then when you listen to what actually you do, it looks like a hugely varied and hugely interesting career. So if anyone is...
Yeah, the nice thing about it, if you want to choose an area to go into, you can do it. Small bowel ultrasound is not something we do in Nottingham, and I started that a month ago. I've just started, and over the next year, I'm going to be training up. I did a little bit as a trainee, but I'm training up myself and a consultant colleague. So hopefully in the next year or so, we can then be trained. We can then start training the trainees and developing the service more. So you start new services as well.
Yeah, so there's room for innovation, and I guess as technology increases, is one of the areas of medicine that's going to benefit hugely, isn't it? Radiology, every time there's a new jump in technology, it's going to come into the radiology side, which is amazing. So if anybody is watching this and is thinking, is it for me, is it not for me, I didn't know too much about it, hopefully it's given you a bit of a flavor of what it can be like. We've talked a bit about the application process. We talked a bit about Radiology Cafe, which you need to go on if you want to learn a bit more about radiology in general and look at some resources out there. Where are you on? We're obviously on Instagram right now, but what are your handles, Chris, on Twitter, Facebook, and any others, just so people know?
It's at Radiology Cafe, RADIOLOGYCAFE, all one word.
Same across all socials.
So the only different one is Instagram, which is radiology.cafe, but you're on here now, so you should be able to.
So drop Chris a follow, drop Radiology Cafe a follow if you haven't heard of them before. And if you guys are from Radiology Cafe and you're seeing us for the first time, we're at auramedicaleducation.co.uk. We do lots of training for PLAB, for MSRA, for GP training, MRCGP, medical exams, and many others as well. So have a look at the website if you can. And please don't forget, if you're praying for MSRA, take advantage of the 10% discount, Arora Rad Cafe 10. Even if you're not thinking about radiology, please do use that coupon. You might as well get a discount. Chris, thank you so much for your time. I think it's been really valuable. There were a lot of comments coming in, and I caught a few of them, but I didn't catch them all. If there's any questions that I go through at the end and I find, I might just drop you a message and see if we can get those answered for people. But I missed a lot of the comments, so apologies. I was trying to read them as we went through, but there were so many coming through.
I can see the cutoff for experience in radiology. That is true. Last time I looked, it was around 18 months. So if you've done more than 18 months as radiology, you cannot apply to ST1. Okay, and that's probably because you're a senior radiologist or more senior trainee elsewhere. So you can only apply to ST2 or 3 or even to a consultant equivalent grade. And that's just to stop people that are, senior radiologists in other countries applying for all our junior radiology posts rather than our more junior trainees. So it's a sensible rule. But yeah, if you have done more than 18 months experience, that is true. But you'll need to apply to a more senior grade.
Yeah, that's really useful actually. And which is the website that people can go to get to learn more about radiology training and applications? Is there any particular site that you'd recommend?
So other than Radiology Cafe, the Royal College of Radiologists is a good point. If you Google Royal College of Radiologists, they've got a whole section on applying to radiology. And it's not overwhelming, it's very simple, but it's also got the links to the Oriel application process and timeline and other things as well. So that's probably what I point you to.
Brilliant, but it's all on Radiology Cafe anyway, right?
Yeah, it's all on.
It's all there.
The Royal College. I think they're a very important resource, and they will always be like the one to go to. They have very little, but what they do have is
it counts.
It counts, yeah.
Yeah, fantastic, brilliant. There's a couple of questions coming in asking about challenges. We've already covered that, so we'll put this video out on. It'll obviously be on Instagram to watch back. It'll be on YouTube. It'll be on Facebook. It'll be all over socials. So you can watch this back at any point, hopefully in the future. Chris, you've been amazing. Thank you so much for your time. I'd love to do one of these maybe at some other point if we get some of the questions coming through about radiology in general.
Thank you, Dr. Arora. Thank you.
Brilliant. Take care, Chris. Bye.
Bye-bye.